Welcome to another show. I am your co-host, Pat Ivey, and with me is Dr. Ted Lambrinides. What's going on, Ted?
How you doing, Pat? Looking forward to today's guest.
Oh, we got a live one today. Dr. Ernie Reimer, how's it going?
I'm doing great. Before the podcast, you told me that today's episode could go off the rails, and that would be on the rails. So I'm ready to go if you are.
Well, let's do it. And I'll introduce him as Dr. Eric Serrano. But after that, he has asked us to just call him Eric. So without further ado, Dr. Eric Serrano, how are you doing today?
Good afternoon, guys. Nice to see all of you guys. I mean, as you know, I was having difficulties on getting on into the podcast, so that was pretty hard, by the way.
Well, you did it. You did it. And you're here now. Can you tell our listeners a little bit about yourself?
Yes, I'm a family practice physician. I'm the only real doctor in this group, by the way. I don't know what kind of doctor is Dr. Pat Ivey, but he said not to give him mail, but I'm going to. Actually, I'm a family physician. I've been practicing for 32 years. I started as a conventional physician, and I was going the wrong way. I was not really helping my patients. Even though I did obstetrics for 9 years, I worked in the ICU for 6 years. I did ER for 2 years, and I was not doing my job correctly. And I said, this has to be another route. And that's when I delved into nutrition. I did my master's in exercise physiology. And when I started making patients better, really better, not treating the symptoms, but the conditions, it took off. My practice took off.
You know, this is interesting. I think everything is timely. When I get a chance to interact with you, you tend to be more on the physical therapy side. And then I go and do more research and realize you do nutrition and you're a real doctor, not like me. I'm the book school kind, you're the real kind. And you have a lot of things going on, Doc. So tell us more.
Okay, actually, my expertise is not even physical rehab. That came after many years of being involved with athletes. So it's kind of funny. It always started with nutrition. And actually, I work for different companies and I created supplements on the market that are now really famous. For example, I was the first person to use glutamine or brought glutamine into the market. I also was the first person to introduce brand change amino acids. And when I was doing that, I was meeting athletes, and then the athlete would say, well, I'm going to this person, I'm not getting fixed. And I was also competing on powerlifting. And I know I see you guys lifting big heavy weights and doing all that crap at the Sorinex, right? And I'm thinking, oh my God, I remember when I used to do this. I had nothing to prove in my house or anywhere that I lifted weights. My wife threw all my trophies out. I mean, I had a little trophy that says world record deadlift. That's gone. She threw it out too. So I can tell you I powerlifted for 3 years, competed on the nationals, and I had no proof for it because there was no internet then, right? But the reality started when I was seeing people for the nutrition component, and again, I helped several companies do supplements. I also have a lab right now. I had a research lab in Colorado for 8 years. Actually, it was a company called Muscle Farm, which was very famous for, I would say, fighters. It still exists, I think. I'm not sure. And we had a lab there for 8 years. We did research for all the supplement companies. So they would choose a supplement, they would send it to us. Can you guys do research with this typical supplement? And we did. And eventually there was some kind of economical issue with the company and they let the lab go. Now, recently, I'm the medical director for 3 companies, the biggest CBD company in Ohio. I'm also the medical director for Muscle Feast, and I'm the medical director for another company called InfinityFitness.com. All of them specialize in supplements. All of them specialize in certain parts of supplementation. I had never signed a contract with one particular company, so this is a shake hand with these companies. And the reason I did that is because I didn't want to be a prostitute, meaning if I work for a company, I wasn't going to say this is the best company in everything, because there are companies that are better in other things. There are companies that are better at doing something else. And I wanted to make sure that my integrity didn't suffer. So in every company that I have worked with, I always make sure that that company understands that if I want to talk about another company and if they have a better supplement, I was going to say it. And that, being honest, has opened the doors for many things. I had a contract with the NFL also. I have contract with different set of schools, and it has been amazing. And it started first of all with nutrition, but then when I will get there, the guys will bring me, oh, this guy cannot fix this, or this guy cannot fix that. And I was looking at the whole body. I was not looking at just a body part. And like as you see me, like if I have elbow, I go check the elbow and they gave it in the shop, but it was never the elbow. It's because the lower lat was not firing, so the upper lat cannot fire, cannot hold the elbow steady, and that became a secondary expertise on rehab. But again, my strength is actually nutrition. Rehab is just a slide on the side that I do. I also like, one of my biggest hobbies to train police dogs, and I still do that. I think that's pretty much, I taught at Ohio State for 6 years. I'm still teaching for OU. I do some teaching for different schools, but that's basically my biggest, I would say my biggest and concentration is seeing patients in my office. And what I would do is I schedule patients an hour. So when you come and see me, I spend an hour with you every single visit. Why? Because it takes time to talk to the person. It takes time to recognize the person. I do not do Zoom because in the Zoom, I cannot read the patient. I like to see how you move. I like to see how you walk. I like to see how you sit. I like to see how you react when I'm speaking with you. For example, today I saw a patient that is a very successful patient, and he's relaxed when we started. Then all of a sudden he started crossing his hands, crossing his legs, because he got kind of intimidated by me. So I backed up and we started again. So again, the cool thing about what I do is that I always look at the whole picture, not just at that one thing. And basically that's why.
Yes, Eric, over the last couple of years with some of the athletes that you worked with, during these COVID years, relative to advice that you've given them with regard to supplementation and the vaccines, what have been some of the things that, your practice has come across with regards to that?
Well, as you know, the vaccine is kind of voodoo for doctors because what they're doing with the doctors. For example, they say that doctors were using ivermectin, that doctors were using hydroxychloroquine, how that didn't work. Well, in 2000, let's start from the beginning, 2019 or the beginning of 2020, I gave a lecture to physicians in Europe. And it was about COVID, but I was looking at the science of COVID. For example, most people don't understand that COVID has two phases, phases L and phases H. One is phases because it's the lung, and the other phase is because the blood. People did not die because they couldn't breathe. That's one of the biggest myths there is. People die because the blood fails to carry the oxygen. That's why people will get intubated, okay? And people do not know this. People will get intubated as soon as you show up, short of breath, but then you didn't get better. And the reason is the lungs were actually working. It was that the transport of the oxygen from the lungs to the rest of the body was not working. And that's what we failed those patients. I don't think that COVID was what they say it was. I seen some of that was very media exaggerated, okay? Yes, COVID was a virus. Yes, COVID can hurt you. Yes, COVID can kill you. I lost a couple of patients to COVID. Very sad. Both patients had diabetes, of course. I think one of the biggest risk factors was diabetes. And the second biggest risk factor was vitamin D levels. And let me give an example of this. In my office, your levels were from 0 to 25. The research shows that if vitamin D levels were 0 to 25, you have 89% chance of dying in the ICU. If your levels were between 35 and 45, you had a 69% of dying. But if your levels were over 80, you only have a 0.08% of dying in the ICU. Why we did not appreciate or tell this to the people out there? Listen, we need to take vitamin D. Now, this is very important because most of the people now, what they do for a living is sitting in front of a computer, or they never go outside. And the only way to get vitamin D levels that are high enough were going outside, and people stay inside. By the way, vitamin D lowers insulin insensitivity, meaning it makes you more insulin sensitive. Vitamin D is the captain or the general of the immune system. It's very important. And again, this was a factor that was not shown out there to the patients. I saw over 200 patients. I never closed my office. Again, I lost 2 patients, but I never closed the office. I did a lot of, I would say, diet changes to those people. I use vitamin C. I use zinc. I use hydroxychloroquine. I use ivermectin. I use all those medications. When I'm giving my presentation to Europe, this is 2 years before this started, the guy that I was presenting to was from India. And he told me, oh, my military all take ivermectin. And I go, what does that have to do with anything? And they say, oh yeah, ivermectin is a drug. Now note that it's just one of the drugs that they're going to start using now here in the States. And I think people are using it. There was also steroids that shouldn't be used. Just also control the sugars that was never, I would say, addressed. We just address, oh, you're sick, we need to give you a vaccine, we need to intubate, we need to do all those things. We never prevented. We never talk about how the system was before you got the COVID virus. I'm assuming that everybody in this table got COVID virus. Is that correct? Yeah, because I got it. When I had it, they forced me to close my office. And then the biggest thing that and I have not said this to anybody, I didn't get really short of breath. I mean, I was doing hay, bales of hay. I got severe testicular pain. I mean, it was so bad I couldn't sleep. I'm 24 hours. It was severe. And I'm like, what is going on? And then when I looked in the research, there's a 28% chance of getting severe testicular pain, but only between the ages of 20 to 31, which I'm way beyond that. I'm double that. But it was very interesting. And to answer your question, Dr. Reimer, there seems to, and I might be wrong, let me repeat the question. Are there things that I can use to treat the virus? Is that what you're asking me? Or what were you asking me?
Yeah, I was saying, in case you had an athlete that, tested positive, what could they do, to maybe expedite the recovery?
Okay, so I now understand the question. Well, first of all, is this testing positive doesn't mean that you're going to get sick. By the way, I want to tell you that to everybody here. I don't care what you tell me. Positive doesn't mean equals sickness. Okay, positive means that I use a good test, supposedly, to say that I have this virus. Now, yes, I have a lot of athletes that tested positive. They were playing in sports or whatever, and I went ahead and treated them. Now I treat them depending on the symptoms of that athlete. If the athlete was short of breath, I will use steroids. I will use inhalers. I will use Azithromax. I will use whatever I needed to use to stop whatever symptoms that patient had. Now I monitor those patients. I follow them continuously. A research paper came out, and I forgot who it was, that you can use hydrogen peroxide in nebulizer. And I know people don't even know this, but using a little cup full of hydrogen peroxide in a nebulizer with the wonders for those patients. So it depended, Dr. Lambridis, on what symptom they have, but I did. I did other vitamins and I added medications, depending what the situation was.
I like your answer. It's trust your training, right?
Absolutely. It's kind of funny because the treatment based on the people was only you to get the vaccine so you can prevent it, which was false. No, the treatment was not that. The treatment was make your body strong so you can handle the disease. And that way you can really actually get better. The problem is we do not care, that's like We don't tell people you need to take care of yourself. We just say, oh, you cough, I got to treat the symptom. Or you have high blood pressure, you have to treat the symptom. For example, in 1958 or 48, they did a massive study on blood pressure. And they did everything, CAT scan, blood test, everything they could possibly check. And what was the number one reason for high blood pressure? Stress. Okay? And there's two types, in medicine, there's two types of blood pressure, essential and non-essential. Essential means, yes, you have high blood pressure, I don't know why you have high blood pressure, which is 90% of the population, which it means it's stress related. Actually, I think the biggest stress for, the biggest reason for blood pressure is either, yes, I do have stress, but it's complicated with a malnutrition factor. And people do not understand that. Of course, they want that pill that is going to lower my blood pressure, which lower the symptom. It didn't lower the cost of why you have high blood pressure. So it's a huge deal. For me, I do not want to treat any freaking symptom until I know what the truly cause of it is.
Eric, I know that Dr. Reimer works with physicians every day, and so some of them may be listening to this. What question can you ask a sports scientist related to what you do?
Okay, this is a very hard question, Dr. Ivey. One thing is, every single patient that I ask in my office, if you can change 3 things on your life, what are those 3 things? And I say, I have a magic wand that is going to change those 3 things. Now, I tell the patient, before you answer, think about what I just asked you. I can change your life, those 3 things that you can change. And it's kind of funny because when the person think about they can really want to change, it has nothing to do with what they're in my office for, which is crazy, you know? And I'm going to give you an example. I had a guy that came to my office. He has high blood pressure, chest pain. And I examined him and I do everything. I still couldn't know why he had chest pain. And I asked him very specific questions. Well, the answer came later because I asked all the kids. Yeah, I have 2 kids, 1 daughter, 1 boy. Well, the answer was, recently my daughter decided to change gender. And that completely stressed that father up, which made him have high blood pressure, have chest pain. Another sample is, I had a patient that, this is really interesting. He continued passing out, right? This took me 7 months to figure this out. This guy kept passing out, went to the cardiologist, went to the neurologist, went to ENT, went everywhere. And finally, he decided to come and see me. And I went through all the records. I mean, he had every single record. I asked, when do you pass out? And say, you know, it can be anywhere, it can be at home, it can be anywhere. And, you know, after 3.5 months of me working with him, I said, I don't know why you're passing out. I haven't figured out. And then he walked out of the office and said, oh, well, thank you very much. You know, thank you for your services. And when he walked out, I thought about one question that I keep forgetting to ask him. And when I ran out to the car, the guy has passed out in his car. And I walking up and I said, what's going on? And I go, wait a second. And I'm listening to the radio. And in his radio, he had tapes. I remember those little tapes, right? Cartridge. I know people don't use those anymore. And I go, wait a second. He was listening to a Sherlock Holmes show. And I said, when do you pass out? I said, I feel great, but then I want to sit down and I pass out in my car. And I said, wait. You told me I turned the car on. When I started listening to my show, I passed out. And I said, when did you pass out? I said, no, just listen. And then, can I rewind your Sherlock Holmes tape? When I rewound it and I played this, Dr. Ivey, you think I'm going to be crazy. I played the tape again. They were describing how the criminal was taking the woman's neck and cutting it open and bleeding all over the floor, right? It was very, very, very dramatic. The guy hold the neck, hold the woman's, the eyeballs were being squeezed, and then all of a sudden he cut with a big knife and he started bleeding. And when I'm listening to it, the guy passed out again. So all this time, I'm looking at the most expensive test. And the reason he was passing after asking, when have you truly been passing out? He said, I like to listen to mysteries in the radio, and I would put it on. I never thought about it because I pass out. What would find me pass out? It was because he was scared of blood. So I took him back to my office and I told my nurse, get a needle and get blood out of him. He immediately passed out. So it was all mental. But I would have never found out if I didn't follow him to the. I know that's crazy, but he was so happy that I'm glad that he never drove when he was listening to those tapes, because he could have passed out. So that tells you how powerful the mind is. I also have I love the mindset or the brain, and it's incredible what the mind can do for an athlete. But to go back to your question again, that's my first question. What can I do to change your life? Or what can you do? Or what can I do to change your life? Or what are 3 things that you would change in your life that you cannot change? And usually that answer will give me what they're seeking from me. Sometimes I can do it, sometimes I can't. But it's a great question to ask. I have one more question that I usually also ask, because I see so many different types of jobs. I say, if you got paid the same as everybody else, 4 hours, didn't matter what job you were, doctor, chiropractor, a PhD, a physical therapist, what will you be doing with your life? And it's sad when a lot of chiropractors, medical doctors, or somebody as a lawyer would tell me, you know what? I'll be a fisherman. I'll be playing on fisherman tournaments. I'll be a professional bowler. It's kind of crazy what they answer. And like, why don't you do it? When you go for it, when you do a hobby. I said, oh my God, I never thought about it. I never thought about that. And I guess I like to play with the mind. That's what I do well. I hope that answered your question.
Yes. So I've got another question.
Go ahead.
When you bring people up in front of crowds, like you've done with me a few times, are you trying to embarrass them?
No, I promise I don't do that. Okay, so Dr. Ivey saying this because, for example, on the last conference, I said, who had very, very strong hamstrings? Remember that? That was my first question.
Right.
And there's always some guy that says, I do. So I said, okay. And they tell you that they can leg curl, 500 pounds or whatever it is. And it's great. They can do that on a machine, but the brain is required to do that. And when you're walking, Dr. Ivey, you think about it. Do you ask your hamstring, let me take one step? No, you don't. The nervous system works without the comprehension of you asking. It works automatically. And in this case, and Dr. Reiner and Dr. Lamberidis, he's asking me the question. I want to answer why. When you do a leg curl, you're thinking about you flexing your leg. Okay, I'm going to flex my knee. I am doing it consciously. But in reality, when you walk, when you run, you're not telling your right leg, oh, I'm going to run with my right leg. I'm going to do my left leg. No, we don't do that. We do that unconsciously. So what I do, and I did in particular to this person, was I'm making it down the floor like I'm a leg curl machine, and I sat on top of them. And I say, I'm going to push on your right leg, right? Are you strong? Really strong. And when I push on his left leg just dropped like a hot potato. No strength whatsoever. And I said, wait a second. So you were ready. So what you said you were going to push on the right side. No, I push on your left. I said, okay, I'm going to push on you right now. And I go ahead and push back on the left, right? Now they're prepared for me to push them down on both legs. But I say, I'm going to push on your right. And if you push on the right, they're really strong. But if I push on the left, they're completely weak. And that's because the brain is telling him, oh, my right leg is going to be holding, but my left leg is not prepared. And that is really important when you train an athlete, because the athlete is moving unconsciously, not consciously. I know you start running, coach, and when somebody's coming at you from the right side, you don't think, oh, he's coming from my right side. It takes 0.2 seconds for you to make that decision. And I like to make sure that my athletes do have that to respond to that type of reaction. One of the biggest strength coaches, and I know that people don't understand this, the best strength coaches sometimes are not out there. And by the way, for every listener out there, the best strength coach is not the one that makes you stronger, it's the one that fixes your weaknesses. I want you to hear that. It's not the one that makes you stronger, but the one that fixes your weaknesses. Okay? There's a guy named Chad Ike. He's a very short Hawaiian guy. And you don't think anything about this guy. His talent to make people faster, stronger, quicker, it is amazing, but nobody heard of this guy. Why? Because he's too busy training his athlete. He doesn't care. He doesn't have time to put stuff on the internet. And it's incredible. This guy's in Arizona. Not many people hear about that. So you know, it's just surprising when you go to somewhere and you're humble by the knowledge of other people. Like when I go to sorting, I talk to you and the other guys are talking. And when Sean gave his speech about running 53 miles after a deer, you know, which how can you freaking run 53 miles? You know, and here he had a little pouch to prove it, you know. And Dr. Ryman and Dr. Lambridis, you guys were not there, but this guy is a good friend of Bert, right? And for Bert, he had a gift. And this gift, and I'm not making this up, I was there, he had to run again after a deer, but he cannot shoot this deer because the spirit has to come through the mouth. He has to come out through the lungs. So they have to run this deer down until the deer drops of exhaustion. And then once they drop, the guy gets close to the deer and takes corn powder and throws it on the mouth of the deer or the nose, and they inhale that and they die. And once they die, they take the skin that now is intact and they make pouches out of it. It is crazy. How can a person outrun a deer? They don't outrun it. They just catch it. Eventually, a deer cannot run as long as a human being, which is crazy that a person can do that. You remember that, Dr. Ivey? It is insane.
Yes.
We do not know what the human mind can do when it starts getting into it. And that's what I also tell my patients, necessity brings creation. And today in our daily life, we are kind of enabling the new generation to be lazy. And I hate that. I truly hate that.
Eric, I have a question. When they
Yes,
talk,
sir.
The average male today has less testosterone than his father or grandfather. And they come into your office. Of course, nobody wants to admit they're the average male, but what are some suggestions that you make to individuals, to improve their ability to maybe put on muscle mass or, increase their
Okay. Absolutely. First of all, I don't want to say this. The levels of testosterone doesn't mean that you're going to be more muscular. Of course, we're talking anabolic steroids. That is true. Now, in daily today, yes, you are correct. I see more and more men with less testosterone than a decade ago. That is absolutely true. I don't care what so you looked at it. I see it. Now, there are many, many reasons for that. I'm going to try to concentrate on the main reason. One is, how much time does a male person spend outside? Which almost is none. It's always computer. It's always sitting on an office. They never go outside. Vitamin D levels are related to your testosterone levels. If your vitamin D levels are low, usually your testosterone levels are low. Okay, why? Because cholesterol was what makes testosterone. Cholesterol is also what makes vitamin D, which brings another huge subject. Also, what is the main vitamin used to make testosterone? You guys know? This is a funny question, but what is the number one vitamin used to the process of changing cholesterol to testosterone? Niacin. Okay, and most people don't even know that. So the last step to convert the androstenediol to testosterone requires niacin and zinc and vitamin C, which most people don't understand. So nutrition is a huge issue. Now, another issue is toxins, xenoestrogens. The number one contaminant of water in the whole entire United States is birth control pills. In the water, number one is birth control pills, which you ingest when you ingest crappy water, which affect your hormone levels. Number two is Prilosec, and number three is Prozac. So, which is very, very interesting. So we have less depressed people, I guess, because you're drinking Prozac, which is not true. But that's so xenoestrogens. Another thing is toxins in the system. We tend to consume a lot of processed foods. We do not consume foods that we used to consume before. Also, the amount of fat that is consumed right now is absolutely decreased because we're scared of fat. We tell people not to eat fat, which is an absolute lie. For example, Dr. Reimer, Dr. Lambridis, can you give me an example of a vegetable oil? Give me one sample of a vegetable oil. You guys know one. Go ahead.
Corn, canola.
Corn, canola. What else?
Olive.
Peanut oil. I don't know if that counts.
Okay, it's funny
Olive
because
oil.
all of you guys are wrong. Okay, what's canola? Is that a vegetable or a seed? What's peanuts?
Yeah, I wasn't sure if that counted.
No, there's no vegetable oils. It's a lie, but we tell people that corn oil is a vegetable oil. Is corn a vegetable or a grain?
A grain.
There's no. That's right. Have you ever seen broccoli oil? Because I've never seen it. You know, it's a total lie. Here are dietitians telling patients in the hospital, "Oh, you need to drink more vegetable oil." Oh my goodness! And I sit there listening to the talks of the patients, and when I ask the dietitian, "Okay, give me an example of vegetable oil," olive oil, and I said, interesting. The last time I looked at an olive was a fruit, but you know I might be wrong. What's coconut oil? What's coconut? A fruit. There are no vegetable oil. It's a total lie. And I get very angry at this because that's a myth that people perpetuate through the years. There's no freaking vegetable oil. It's a lie. Tell people, no, don't lie anymore. Another thing that I see also is what in nature is concentrated fat. Where can you find only fat in nature? You can't. The reason is God is amazing. God gave you proteins and fat together. So when you eat your proteins, you got enough time to digest that protein because the fat slows down the digestive system for you to be able to digest that protein. The reason for that is because in nature, nothing is protein by itself, but bacteria and viruses. They don't have fat, but they're pure protein and pure purines, pure DNA, pure RNA. There's nothing in nature that has that by itself because God intended you to consume fat. What in nature is pure energy? What in nature is pure carbohydrate? You guys have any idea? The only thing that you can find as a source of pure energy is honey. It's the only energy source that is quote unquote almost pure carbohydrate. And it's not pure carbohydrate because you know that honey doesn't go bad, right? You guys can leave honey open. You can, if you buy raw honey and you leave it open on your counter, it will never go bad. You guys know that. That's because they have all these amazing proteins in there that actually protect that honey from getting any type of bacteria grow in that. You cannot grow bacteria in honey. Isn't that weird? And it's sure, but you cannot grow it. For example, if you get a staph infection, this is a cool trick here. I always like to give you information to take home. If you get a cut on your arm, I don't care what it is, and it's infected, you put honey on it. Within 48 hours, it gets better. It doesn't matter what you have, a staph. It doesn't matter what you actually are infected with. It will get better. It has antiviral, antibacterial properties. It has to be raw. Cannot be the junk crap that you buy on the store, but it works amazingly. Now to the point that Amazon is actually selling a honey brand for bacteria, antibacterial. So it is crazy what we know. Now to answer the question, Dr. Lambertis, yes, people are coming with lower testosterone levels. Also, I see a lot of teenagers using a lot of pro hormones, SARMs. I don't know if you guys remember Androstenedione. Those have been not removed from the market. Now you got the 40s. Now you got all these pro hormones that I see that kids take that you can buy over the counter. And I see kids between 12 and 17. For example, yesterday I saw a kid with a testosterone. This is incredible. A 17-year-old kid with a testosterone level of 6. Okay. And the father brought him to me because he couldn't have erections. Isn't that sad? A 17-year-old kid. Now, when you ask the history, he took RAD40. I don't know if you guys are familiar with that. It's kind of a pro hormone, right? Or a SERM. They're called SERM or SARMs, right? You guys know what that is, right? Or not? Okay. So this kid had been taking for 3 months. He had been taking the supplement that making stronger. Yes, it works, but he took it nonstop, and now his testosterone levels, once he stopped it, are not there. So is that a toxic? Yes, it's a toxic element which he kept taking. Well, now I have to fix this kid. Now the kid also have pure diet. So people are coming with absolutely less testosterone levels, but they're less active, spending more time on the phone, iPad, or computer than spending outside playing football, playing basketball, being outside like kids, running the bikes, playing time with your kids. We use the TV and the computers for babysitter purposes, and we need to stop doing that. We need to spend time with their parents. We need to sit at dinner time with the kids. I had a rule in my house. Dinner time, everybody has to sit at the table. You cannot go watch TV. You cannot go upstairs. Everybody sat down. And that's another thing for testosterone levels. Number 3, because we lower our content of fat in our diet. Again, testosterone is made out of fat, specifically cholesterol. We're going to have issues. And the reason is we're eating, by the industry, we're eating more polyunsaturated fats. That's what they tell you to eat, right? Polyunsaturated fats. No, you don't need. Okay, I got another question for the board here. What is more about if I have a prime rib, right? And I have tuna. Which one is the most abundant fat? Which one has more fat, first of all? The prime rib or the tuna? Coach Ivey, come on.
I'm going to say the prime rib.
Prime rib. I agree with all of you guys. That's more fat. Now, which one is the most abundant fat in the prime rib and the tuna? Which one is the most abundant fat? A poly, mono, or saturated fat? Which
Prime
one is the
rib
most
will have more
abundant?
saturated fat.
And which one?
Prime rib.
Dr. Labrie, you accept that answer?
Yes.
Wrong again.
I disagree.
Yeah, the most abundant fat on the prime rib is actually monosaturated fats. Even in breast milk, which is the best food out there, nicely packed for free and convenient, breast milk has more monosaturated fat than all the other fats put together. So no, you guys, people tell you, oh, saturated fats are bad. No, the most abundant fat is monosaturated fats in every species. Look it up. It's crazy. People don't know that. Another thing, and this is before your time, Coach Ivey. You know what lard? You know what lard is, right?
Yes.
Remember that?
Yes.
Then when you take that big glob of fat and dump it onto the freaking fry pan, right? Well, people say that is 100% saturated fat, correct?
Yes.
Wrong again. It's only 49% saturated fat. There's a lot of mono. People don't understand, looking at the science things, is how stupid they are. When I was little, my mom, we have that lard, remember that, on a big container. I said, Mom, I want fried eggs. What do you think she would do? Turn the heat up on that lard that was hard, heat it up and boom, dump the eggs there. Then I will be eating my eggs in fat, Oh, but I want a chicken. Oh shit, hold on a second. Here comes, she will light up that lard, put some adobo on it, dump it in there. Man, toasted chicken, very wet and amazing, So people need to understand that the education that they're getting is not a great education. It's actually a very poor education. We need to look outside the box to understand why things are happening. And I hope that I'm giving you hints here of why things are not good. Any form of concentrated oil is not that great. If you're going to use any type of fat added to a diet, it should be monosaturated fat. The best one is olive oil, okay, by far. No other oil is better as olive oil. No, I don't make any money selling you that. Also, number 2 is if you're going to deep fry stuff, just use lard because it's higher on monounsaturated fats, by the way. If you're going to fry and you want a liquid oil, then use avocado oil. It's actually stable in heat. It doesn't get damaged. As soon as you heat canola, as soon as you heat any form of vegetable oil, and you heat it up, you damage it, which is oxidized. In 2002, we analyzed 32 different fish oils from the market. I went and I took them. I went to Walgreens, Costco, everywhere. It didn't matter what the brand was. Out of 32, 29 were oxidized fish oils. Oxidized. Is that going to do good to you? No, you're already taking oxidized. That's why you have to be careful when you buy supplements. If you're going to buy fish oils, do not buy it on a transparent bottle that looks pretty. Oh, look how pretty they look. They look golden. As soon as the light hits them, they get damaged. If you're going to buy any oil for your kitchen, has to be in a dark glass bottle. Cannot be in any plastic, cannot be in any transparent container, or it has to be in a can. That's the only one you should buy oil because it's oxidized, is in any plastic or transparent.
So Ernie, I gotta ask, because I've learned to read you a little bit, and there's probably a few things swimming around in that massive brain of yours. What's going on? What's going on in that brain?
Well, I got to be honest. First of all, this is the second time in just a matter of months when someone said that, brought into question the nature of our doctorates. I think we were at a meeting with some engineering professors, and they asked what we got our doctorates in, and then they turned around and said it was the easy stuff. So I'm getting used to being around really smart people who take away from the quality of the PhD that we have. So fine. The second thing is, you're mentioning, age and talking about things that were going on before Dr. Ivey, was around. And I'm an AC/DC fan, but my wife's parents are older than mine. And so she listens to an older generation of music. And we were at a Paul McCartney concert. And one of the things that I thought was just brilliant was how every song he changed instruments. He picked up and used a different tool to do his job. And we're all over the place today. So what I want to ask you is, what do you find in common between training police dogs and training your patients who are humans?
Wow, what do I find? That is it. Shit, I know you're gonna ask me a hard question. Actually, I don't know if this common. I would say it's more uncommon. You know that the dog has a certain instinct and is gonna do what that dog has been trained to do. Humans are so different on the same situation. And I'm going to give you an example. If I make you put your hand on a cold water, and I ask you and him and you, put your hand on the cold water, what do you feel? And each of you is going to tell me, I'd feel cold, or I'm going to feel, you are going to come with a different answer every single time. The one thing I have in common is how uncertainty is the dog is going to react to me when I come towards him to attacking or fake the attack, because he can react with fear, he can react with aggression, he can react with something different, and the humans are the same way. If I bring a question that rumbles their world, like I never thought of that question, they get fear and they start thinking and moving backwards. But I think that the dogs bring me an adrenaline rush. When the dog's coming 100 miles an hour to attack me, I only have 0.2 seconds to react, and that dog can hurt me. I've been hit so hard that I'm flying like a helicopter when a dog hits me, and I seek that little rush. When I'm with a patient, I am so humble because and this is what I have in common within dogs and humans. Every time I train a different dog, I always learn something new that I didn't know yesterday. And every time that I human contact, I learn something new from each person. It doesn't matter which patient it is. I always learn something new, different little, details that I didn't even think to ask. One big example is I have a patient that brought me his wife. And through the history, weight loss, all the things, had big scar in the middle of his belly, right? And this lady did not want to have intercourse. That was the complaint that they were there for after 2 children. And when I examined her, I asked, how did the scar happen? Oh, in a car accident, right? And I went through everything, but I noticed that there was an anger every time I asked about the scar, but she never told me about the anger. And when I finally said, okay, how do you get the scar? And she yelled at me, she said, I told you, in a car accident. I said, well, hold on a second. I just want to know, well, this scar, I lost my colon, part of my colon. I suffer, I lost weight. I lost 2 years of my high school. And she then started moving on and on until I finally said, who was driving the car? And it was her older sister that fell asleep in the car. And they haven't spoken for 2 years because she thought that her sister was guilty of what happened to her. And then when I talked to her, I was like, whoa. When was the last time to use? I don't want to talk to her. It's her fault that I'm here. And I said, how was her fault? She fell asleep. And I said, did your sister go to the hospital? Oh, she broke her back. And I said, whoa. So your sister broke her back, but she never had any issues. I do. So her anger was not letting heal. And she was having continuous abdominal pain, which we physicians are taught that once I open a scar, and this is another home take for you guys. Once you have one surgery, it doesn't matter what surgery that is, Dr. Ivey, on your knee, on your shoulder, on your back, that scar will leave clues behind onto your neuromuscular system. Okay, let me repeat what I'm going to say. Whatever the scar is, it doesn't matter what it is, your face, your shoulder, your knee, will leave a pathway to your neuromuscular deficiency. So this lady was having severe belly pains, seen every specialist, and I inject the scar with lidocaine. The pain went totally away. I just injected the scar. She started crying and said, oh my God, I never, in many years, I have not had no pain. But that took her to heal with her sister, which eventually she got better. But I learned this from, and this is very interesting. I was in Ireland giving a lecture, and this guy walks in with a cane, right? And he said, I'm having a hip replacement in 2 days. And I just want to see if you can help me with my knee, with my hip pain, which is really bad and it hurts really bad. I did, Dr. Rainer, Dr. Lambris, Dr. Ivey, I did every single test that I could do in that hip. Severe pain. It doesn't matter. He couldn't squat. He couldn't do anything. My friends that were there with me, we became friends just on that past year. He's a specialist therapist. I didn't know what kind of we never got into what kind of therapy you did, right? He has his job, I have my job. And as we developed a relation, and now he's one of my best friends, he said, do you mind? He said, I spent 10 minutes with this guy by myself. So he took him to a room, and I swear to you guys, I'm not lying, this guy was walking with a cane, couldn't squat, couldn't sit down without that cane. He comes out, he's sitting down, walking with no pain, 10 minutes. And I said, what is this? I went, and they wait. He didn't have nothing on his hands when he went in there. And I said, what is going on? I said, Serrano, easy. It wasn't his hip, the problem. He has some arthritis. I saw the x-ray. He has some arthritis, but it's not bad to have that pain. So I said, what is the pain? And he tells me, well, Serrano, it's time for me to teach you something. You never make that guy take his shirt off. And I said, no, you're right. I never did because I'm examining his hip, right? Why will I make him take his shirt off? Take his shirt off. When he took his shirt off, he had a midline scar here from a shoulder replacement. And my friend asked him, how long after the surgery you start having hip pain? He said, you know what? It was 3 months after my shoulder surgery. And my friend said, what did you do? I said, I wasn't doing nothing. So my friend, all he did was, I'm not making this up, rub the scar for 6 minutes. It takes 6 minutes to roll it. I learned this. This is crazy. You guys can try it yourself. Find a scar on your area and see what happens to the rest of your body. So take that scar and roll it. Like you're doing rolling dough, roll it. Roll it on your tip of your fingers, up and down for 6 minutes. Either you get a heat sensation, either you get a weird sensation, either you have a numbness on that area, something happens. If you guys have a scar right now, do it right now. And you guys are going to find out how touching that scar completely changes the magnitude of that patient. I'm going to give you a huge sample. After I learned that, I had a guy that has severe shoulder pain, right shoulder pain. This is a very, very famous picture. His elbow keep hurting. After I examined him, I didn't know why his elbow was hurting. MRI is normal. They did injections, all that crap. Then any surgeries? Yeah, I had a calf. I tore my calf playing basketball off season. All I did was inject the scar on his calf. The pain totally went off of his elbow. Totally went off. Completely no pain free. Throwing back 90 miles an hour. So be aware of how the human body practices. Even on physical therapy, you can make a difference just by squeezing that scar, rolling between Just try. I want you guys to please, you guys have my phone number. I want you guys to call me when you do it yourself.
What's happening in the body to make that happen? You got fascia, you've got nerves.
Okay.
You've got...
First of all, Dr. Ivey, here we go. And I know we have a doctor here too that specializes on this. What has more nerve, your fascia or your spinal cord?
Your fascia.
Damn it, Dr. Ivey, I knew you were going to have the right answer. Yes, the fascia is a total city. If
You told me that before, I just remembered it.
If you separate that city, the two layers of that fascia is all nerve, totally nerves. And it's amazing what that fascia can do. Now, when you do, you guys don't do surgery, but if I open a patient, what do? I just stitch the patient. I don't take the fascia and I join the fascia. I don't take the skin and I join the skin. Doctors just stitch together. And I can see in a trauma or in emergency, you have to do that. But we don't practice. What happened to that city that now the city that have the nerve conducting inside are now like this? You change the stoplights, you change the stop sign, you change all those things. What's going to happen? The signal is affected. Now, this usually everything that I told you, I have 100 papers to back it up. It doesn't matter what you tell me. Oh, Serrano, I don't believe you. I will send you hundreds of papers. I'll send it to you right now. But for that particular subject, I had looked at it and there's maybe 2 or 3 papers because it's not a money-making scheme. Think about it. If you have pain and I rub your scar and you get better, oh, it took me 6 minutes and then I teach you to do it. You go home, shit, I don't have no pain. All I had to do was do that, you know? Now, one great question that you made me think about is how often do you have to inject this scar or how often you have to rub this scar? It depends how chronic that scar is. It can take months, or it can take 3 shots, or it can take only 2 treatments, and that might resolve the issue. Now, there's no research paper stating what truly happens when I do that. So I know you're playing with a scar right there, Dr. Ivey. You're touching a scar somewhere on your knee or something, aren't you? Are you or not?
I can't get to it right now.
I can't wait for you to text me after you do it. Remember, but you have to time it. 2-3 minutes. 3 minutes, you'll see a difference.
Okay.
And you tell me what happens.
All right. I'm gonna come up and visit you too. I want to check out. I want to check out your gym. You've got a gym in your house.
Yeah, I have a basement. We used to have, at one time we have 15, 20 players downstairs working out. As I got older, I used to be the old guy that wanted to be like the young bucks, you know, lift the most weight. I'm getting too old for that shit. Now I'm smarter. I'm smarter than you are, you know. I do a little bit and I fake that I'm doing a lot. And I let you bust your butt there and you cannot lift the weight and I'm lifting it. Oh man, I'm lifting it because I did half of your exercise, you know. But we have in my office, we have hyperbaric chambers. We have special cooling systems. We have lasers. We have ozone. We have all these things that we provide for the patient. So we have many, I would say, we have something called dolphins. Have you heard of the dolphins? Dr. Lambert, have you heard of the dolphins? You know what that is?
No, flipper.
Dr. Reiner? Okay. Dr. Ivey, come on, you haven't been talking to you. What's this?
That's too much. It's too much for them. They wouldn't.
So when we go and give this particular conference, we all talk together, we sit down together. And the cool thing is that everybody comes together. There's only one conference like that in the entire United States, or excuse me, in the entire North America. It's called the Swiss Conference. Have you guys heard of this? Swiss Conference? It's put out by a chiropractor called Dr. Kinaki. It's going to be in Columbus, Ohio at the Easton Hilton Hotel. Average attendance is between 800 and 900 people. And they have at least 40 speakers. And it's all about, you know, bodybuilding, steroids, any subject you can think about it, it's there. Like this year, they're going to have Polchek. They're going to have, I call Eddie Hall. Hopefully he'll be here. Miss Olympia is going to speak. They have 5 doctors speaking there. They have Ed Cohen speaking there. They have, I think they're going to ask Coach Dr. Mann, they're going to ask him to go there. All these doctors and all these people are going to get together, and they're making a movie actually this time There's going to be Bill Kazmaier, the strongest man in the world, because he had been part of that conference a few years. They are filming a movie of him, and some of those are going to be there. They're going to interview people that have been involved in his life, and they're going to be filming a movie during this sports medicine conference. It's amazing. It's called the Swiss Conference. I'll text you guys later, but it's October 28, 29. It is one of the best. I will tell you, everything is there. And these dolphins, that's why I found out about dolphins, because there's so much knowledge there. The dolphin is like an acupuncture electrical current. It's microcurrents. It can deactivate a nerve, or it can activate the nerve. And it does it by influence the ATP levels on the nerve. It's amazing what it can do. And I think Coach Ivey has seen it work. You've been there, right? With headaches. For example, tinnitus. Oh, I love this one. How often you guys see tinnitus on your practice? People complaining of ringing on the ears. Supposedly we can fix it, right? But with this little machine, you can actually From the first visit, you can make a difference on that patient. It's crazy. So I want you guys to check the Swiss conference. I want you to check the speaker. It's amazing. Coach Ivey, you have not been honest with you guys there. I mean, he has seen it work. I can't believe you never said anything to them.
I can't tell them everything, Ted.
I've been here for nearly a year. What the shit, Dr. Ivey?
I didn't say it. I didn't say what the shit, Dr. Ivey. I didn't say it. They're called MPS dolphins. And hold on a second. I'll be back. Give me 5 seconds.
We're gonna have to wrap this one up, because I have a feeling he's about to go to another level, and we might have to do a second
Part 2
podcast.
Okay, here we go. This is how they look like.
Yep. So it's a device you hold in your hand. It's got a little.
It looks like a pen. You're gonna touch the affected area. It is the most comprehensive, perfect for phantom pain. When somebody, I don't know if you guys see clients or patients with phantom pain, this absolutely never seen it fail. This is amazing how this works. The lady Kelly Armstrong, which is the main therapist for this, did a study on traumatic brain injuries because her son had a car accident and they thought he was not going to do well. And within 4 treatments, his son was almost back to baseline. And the cool thing, the treatments are very short. Doesn't have to be long. You can treat the whole body. You can treat whatever. It works for pain immensely. For scar pain, it works amazing. But for phantom pain, or CRS, it works. It's incredible.
Well, Dr. Serrano, we're going to wrap this one up.
Okay, sorry guys.
No, you're good.
Time.
One last question. I don't know if
yes.
I know you have one last question.
Go for it.
Dr. Ted.
Yeah, I've got one. Eric, what would be, say, a couple books you would recommend for our listeners?
Okay. First of all, when we're done with this talk, each of you is going to send me your email. I will send you, each of you guys, 3 books. Okay. Now, give me a subject which kind of book? Dr. Almeida, what kind of subject are we talking about? I like to read a lot.
Yeah, I would say, it doesn't necessarily have to be on human performance.
So it can be nutrition.
Yes.
Okay. So, I want a text from each of you guys. Send me the subject that you're interested on, and I will send you at least 3 different books on that subject or research paper. I'll do it right now before we even hang up. But if I had to pick 3 books, this is going to sound crazy. One of them will be Jesus Calling. It's a Christian book. It's a little tiny book. And that book has, each day has the author talks to Jesus about their day. And it's a very inspiring, all positive. It's not the guilty, or you're Christian. It's a very positive. It's a very small book. It's called Jesus Calling. It's amazing for that person that is going down, doesn't have escape. It really helps. Another book that I will absolutely, especially for therapists, Anatomy Trains. Have you guys seen that book?
Yes.
It is for a therapist. It's an amazing. It's a must read if you want to know about fascia. And for nutrition, it's called Nutrition and Metabolism, and I will send you guys, each of you guys, a copy.
Fantastic.
If you guys send me an email, I'll send you that right now.
We'll
Excellent.
get that done.
Okay.
Dr. Reimer,
Any
you
other
have one
questions?
more? Yeah, Dr. Reimer has one.
Go for it.
Just a comment. So what I wanted to reflect on is just hearing your intro at the beginning. The reason why I brought that up about that concert was I feel like you are an individual who has a lot of different tools that you can bring to the table to help people. And that's why I was drawing that connection. After every podcast, I always reflect with Dr. Ivey and Dr. Ted and talk about how much fun the podcast was. And this was just as entertaining as the concert. What I can tell you is this whole time I've been polling Google Scholar. I've been trying to keep up. I'm looking for papers on these topics you're bringing up. And I'm telling you, there's a lot of, it's all legit. I mean, I'm looking at an article here. It says clinical importance of active scars, abnormal scars as a cause of myofascial pain. And here's one in pediatric chronic myofascial pain. So what I just want to say is thank you. I've got like 20 tabs of Google Scholar up. I'm just trying to keep up on all these topics that you guys have mentioned today, and all these different tools and nuggets of information.
It's kind of funny. I will send you guys information. And if you guys keep on touch with me, I have a massive library of research papers because I was teaching at the university. And I wanted every day, every student has to bring me a different paper presented to me. And then the next day, they have to present a paper that went against the paper that I presented. And the reason I say that, to defeat the enemy, you need to know the enemy. Okay? One of the biggest one is statins. Oh my God, don't get me going on that one. But, you know, I will send you information and if you say, Eric, I don't find this paper, let me know. I love to read. If you don't know more today than you knew yesterday, that means you're not getting smarter, you're getting stupider because you're staying, I just know the same that I knew yesterday. Are you getting smarter? No, you're not. One thing is I have an organic farm. I have alpacas, I got chickens, goats, cows, all that stuff.
I was going to ask you about your alpacas, but
don't ask me that. My wife in the living room, so be careful. Okay. So I'll say this: a smart man learns by his own mistakes, and a wise man learns by the mistake of others. And I was very, very smart at one point in my life. Dr. Ivey's on the 50s right now, and I turned about 50. At 50 and above, I became very wise. I wasn't smart anymore. And I hope that I continue getting wiser, not smarter. So.
Dr. Eric Serrano, it's been a pleasure. Where can our listeners and viewers find you? Is it, you have a?
I'm not, nowhere.
You nowhere.
You know
internet. All right. So I'm going to probably post your, just a few links that can be found about you on the internet. And other than that, if it's too bad, if you all want to reach Dr. Eric Serrano, you can Google him, but this is exclusive. So we're appreciative. Thank you so.
I don't do any, I hate internet. So that's why.
Yeah.
So you guys, that's why I don't know. If you guys want to talk about computers, go for it. You guys will whip me. They whip my butt immediately. I don't know crap about computers.
Well, we appreciate you. Thank you so much. Sir. We appreciate your time.
Send me a text.
Yep.
I will send you books right now.
Got it. Appreciate you. Thank you.
Bye-bye.
Thank you.
Bye-bye.